You may be wondering, what is the solution to lasting weight loss? The solution to this is to maintain normal insulin levels. I'm Dr. Mikulics, and today we're going to talk about hormone reset number 2, sugarless, and this is from the Hormone Reset Diet book. So in days 1 through 3, we went through meatless, where we took out red meat and pork, and now we are going to go through sugar-free and the effects that has on healthy insulin levels. And this is really going to help us achieve our weight loss goals. So I just want to back up and talk a little bit about insulin. It is a gatekeeper hormone, so it really can affect so many of our other hormones, such as cortisol, leptin, estrogen, testosterone. Probably sounds familiar, right? So what insulin does is it fits on the receptors in the cells, particularly your muscle cells, and it's sort of a lock and key type fashion. And it unlocks the cell to allow the transport of glucose or sugar molecules into the muscle cell, for example. And there the glucose can then be used for energy in that cell. So sometimes what happens when we have diets that are high in unhealthy fats, when we have a lot of inflammation in our systems, those locks can get kind of gummed up, and then the insulin does not fit. Insulin as the key does not fit quite so nicely in the lock. Other times there could be other issues where estrogen dominance is at play, or aging is at play, and that's making us more insulin resistant. So our body has to create more insulin just to communicate with the cells and try to get the function of moving sugar out of your bloodstream into the cells. So I wanted to go over the self-assessment questionnaire, and I'm going to take this right from the book. So you can listen along and, kind of evaluate if this seems to pertain to you or not. Do you crave sweet foods? Do sweet foods calm you down? Have you tried to stop eating sweets but found that you couldn't? Have you been told your blood sugar is higher than normal, which is, not all labs may show this, but typically greater than 85 milligrams per deciliter to 90 milligrams. When you go without eating for more than about 3 hours, do you feel shaky, anxious, or irritable? For women, is your waist measurement 35 inches or greater at the belly button? Or for men, 40 inches or greater? Do you have a body mass index greater than 25? And it's very quick and easy to look up online how to calculate your BMI. Have you been told that you have polycystic ovarian syndrome? Do you have difficulty losing weight? Do you gain weight easily or even aggressively? When you skip a meal, do you feel cranky or fatigued? Do you exercise 3 times a week or less? Have you been told that you have low HDL, which we commonly refer to as our good cholesterol, or high triglycerides? Do you have high blood pressure? The top number, systolic, over 140, or the diastolic bottom number over 90? Do you have a fasting insulin level that is greater than 5? So not everybody gets this test done as part of a regular testing done, but certainly the glucose level and your measurements and blood pressure are all things that are routinely done. I wanted to take a moment and just talk about the sugar-brain connection. Because it's important to understand this so you can give yourself some grace as we go through these changes. But sugar is very addictive to the brain, and our ancestors lived for that, because when they got their sugar, they got their energy. So we're just wired to crave and want sugar. There have been studies done in rats where they preferred Oreo cookies to morphine. And what they saw with the rat behavior was they even went as far as to dig out the white filling right off the bat. Other studies that have been done in mice with sugar substitutes, such as sucralose versus cocaine, and the mice preferred the sucralose 10-1, because that connection between sugar and dopamine surges, dopamine being that neurotransmitter that makes us so happy, is very, very strong. So just keep that in mind as you're making your changes. And we're moving this along in 3-day increments because we want to party at Thanksgiving. But if it takes you a little bit longer, that's okay too. A lot of questions come up around carbs. How many carbs should you be eating a day? Is a keto diet better for me? And I found this interesting in the book, and I do see this in my practice, in my personal experience with my patients as well. But typically, when you eat less than 20 grams of net carbs per day, you can enter ketosis. But what this can do is it can raise cortisol, not good for weight loss, not good for stress, and activate a thyroid blocker called reverse T3. Well, we need our reverse T3. We'll get into more of thyroid later, but reverse T3 basically helps provide us with more of the active thyroid variant. So you don't want to be kind of shooting yourself in the foot with an extremely low carb regimen for long periods of time. Okay, 20 to 49 grams of net carbs per day from plants. This does include, at this point, things like quinoa, sweet potatoes, pumpkin. This will help keep you out of that severe ketosis and will reset your insulin. So that's what we're targeting. 50 to 99 grams. During sustenance, you can, which is going to be the phase after all this, you can slowly try this and find what your limit is. You'll see where your weight starts to change and you feel differently. For a lot of people, 75 is kind of their range. I'm going to talk just a little bit about the vicious cycle of insulin resistance. And this is important to know a little bit about. So basically, when we have too much sugar, too much glucose in our system, our insulin levels are going to rise. And then over time, whether it be hormonal changes, continued excessive exposure to simple carbs and sugars, exposures to unhealthy fats, and increase inflammation, which make the lock part just gunky and not quite so efficient. So the insulin hormone can't fit in there as effectively. So over time, when that happens more and more, our bodies, through our pancreas, is going to make more insulin to try to keep up, because the bottom line at the end of the day, our body's really just trying to regulate our blood sugar and get that blood sugar to a normal level. So this creates, in turn, more insulin resistance and more inflammation in your body. So now you have another avenue of disease going on, which is increased inflammation. When you have higher levels of insulin trying to get the job done, you'll be more likely to have these kind of peaks and troughs in your blood sugar levels. And so then this can manifest as being hungry a couple hours after you just ate, because you kind of had that peak. You weren't able to get the glucose into your cells in an efficient manner. It hung out in your bloodstream too long and accumulated, or maybe it was just the nature of the meal that you ate. And then you're going to trough, and that can trigger hunger again, even though you're really not nutrient depleted or calorie depleted. So then as this happens, our body will eventually just convert this extra sugar to fat. And the type of fat our liver most commonly converts extra sugar into is triglycerides. And triglycerides, especially in women, are an independent risk factor for cardiovascular disease. So this is something we need to pay attention to and really be careful to optimize our triglyceride levels through balancing our blood glucose and our blood sugar levels. You might be wondering by this point, well, what am I supposed to do? Three main things. We're going to eat foods that are optimizing our blood sugar balance. We are going to exercise, and we'll talk about that in a little more detail, and supplement. Supplementation can really get you through this because it's not so easy just to, flick the switch like the rat who's trying to dig the creamy stuff out of the Oreo. There are 6 steps to implement with this reset, and I'm just going to read them off my list because it's the end of the day and I can't memorize anymore. Okay, eliminate sugar, obviously. So we're going to eliminate table sugar. We are going to, not always, but right now, eliminate molasses, honey, syrup. Stevia is okay. Artificial sugars are not okay. They can actually wreak more havoc on your microbiome and in the long run create more problem and disease in your body. Stevia, however, has a beneficial effect on your microbiome. So that's one that is okay. You're also going to focus on the slow carbs or the complex carbohydrates. Sweet potato, quinoa, pumpkin, all of those things can be a source of carbs for you that aren't going to derail your insulin sensitivity. And number 2, eat 1 pound of vegetables a day. How can you do this? Well, it's a great idea to prep ahead of time. You might want to steam up some veggies lightly so they can be, ready for versatile use, even in salads. You may want to roast up a big pan of veggies so they can be thrown into that bowl of quinoa and or turned into a frittata quickly. And this can be done even with a busy lifestyle. Number 3, we're going to eat some protein at each meal. It does not need to be an animal-based protein. It can be lentils. Certainly our clean fish and cleaner cuts of chicken, pasture-raised, organic. Those are all better options to go for. Number 4, you'll be eating every 4 to 6 hours. Do not eat in between meals. Your body needs time to properly digest and manage the food you just supplied it with. Number 5, you can have half a cup of a low glycemic fruit every day. Avocado, raspberries, coconut, these are great options. And if you're going to cheat or you're feeling weak, this is where to do it. This is what to do it on, your berries. Okay, and then probiotic foods. Probiotic foods are going to support your microbiome, which are going to support your weight loss efforts. So along that line, let's get into supplements. Okay, supplements that can be used to help balance your blood sugar and reduce your cravings. You are going to want to look for things that have fiber in them, that have ingredients like chromium, chlorogenic acid, which is an extract from the green coffee bean. It's not caffeine, it's just that particular extract that has many beneficial effects on blood sugar balancing as well as blood pressure. Look for things with the Chinese white mulberry. I think I already said chromium, alpha lipoic acid, all of those things. A good probiotic, especially one that has been demonstrated clinically to increase your gut levels of Akkermansia. And Akkermansia is a bug that we call the skinny bug because it's actually been affiliated with more effective weight loss. So in study participants who had more Akkermansia residing in their microbiome of their intestines, they were found to be more successful with dieting or weight loss. Okay, and that's good for your supplements. A good multivitamin because you're shifting how you're eating. You want to make sure you're covering, getting all your nutrients. Something with the methylated B vitamins, super important. And now exercise. Exercise is something that you should try to do 5 to 6 times a week. If you can shoot for that 20 to 30 minute goal, that is wonderful. And you want to do it in a system that's kind of like intervals. So whatever you're doing, whether it's walking or dancing, you're going to do 5 minutes is just normal. Maybe you're on your elliptical, whatever your normal pace would be. And then 30 seconds all out, as if your life depended on it, and 2 minutes recovery. So you can play around with that, that 30 seconds to 2 minutes, and at least 7 cycles. So that's going to give you a really good workout that's not going to take long, that's not going to overly spike your cortisol, but it's definitely going to get that glucose that's stored in your muscles used up. So it's going to potentiate your insulin balancing. Lastly, we want to cover the cell to soul practice, which is our meditative component of these lifestyle changes. And studies again and again have shown how important it is to be, doing the deep breathing, checking in with ourselves in order to optimize hormone levels, reduce stress and inflammation in our body, and ultimately to support, the healthy insulin levels as well. So I'm doing this with you. It's something that, we all, probably all of us, could make more time of in our lives. So this suggestion for this reset is a heart-focused breathing. So initially we would just bring our attention to our center and to our heart. And then you would take a deep inhale for 5 seconds. And then you would slowly exhale for however long it takes you to exhale. If it's the end of the day, it might take a while. And then the third step is to, as you're repeating that breath cycle, to think of something positive, a positive feeling. In the book, she says a time when you felt peaceful or centered inside with a loved one or a pet. And once you kind of get this feeling, this emotion activated, you're just going to focus on that for the remainder of your breaths. And you might just want to do that for a cycle of 10 breaths. It may not seem like much, but believe me, it's kind of challenging. So that's all I have for this reset number 2, sugar-free, and this is going to be the next stage in the hormone reset diet to implement over the next 3 days. Thank you. Bye-bye.